Hi, I'm Robert Godell, and I've just completed a Presidential Innovation Fellowship with the Food and Drug Administration, Department of Veterans Affairs. It's been the honor of a lifetime to work with the VHA innovation ecosystem on Project Resilience. We've had such an amazing response with so many amazing partners, both inside VA and outside, and I couldn't be more grateful for the team that supported us every step of the way. I'd like to start by asking, how has the pandemic affected your community? Take a moment to consider. How has the pandemic affected your family? Most importantly, how has the pandemic affected you? If you're like me, the deep, widespread impacts of the pandemic have been extremely challenging. Day after day, week after week, month after month, we've all been affected deeply, and especially those that we care most about. So when we see a talk like Taryn gave, which was exceptional earlier today, we can start to understand the challenges of opportunities around resilience. But I'd like you to take a few minutes with me to think about, what does resilience mean? And based on how you feel every day, how do you communicate what you need to those who care most for you? Now, we all have one of these, usually within arm's length, right around us. And at its core, it's a phone. It's the ability to reach out and talk to those of us in our lives that care for us and we care for them. But yet, when we most need that support, we don't use the phone for what it's intended for. Even as over 90% of those under the age of 50 now have a smartphone. So what we've been looking at in the VHA innovation ecosystem is how other technologies, smartwatches, fitness trackers, how can they help veterans, VA staff, caregivers, how can they help alert when is a good time to reach out for further support? And for just one vendor alone, over 15 million users of these technologies are available for us to understand how they can better support different aspects of care. And when you combine the capabilities of measuring the physiology in high precision with the ability to communicate needs, now you start to see the real possibilities of what's available with innovations. So we launched Project Resilience back in January, and the reception was just amazing. We had over 46,000 veterans sign up to participate in just 2 weeks, almost 4,000 VA staff. And this pointed to the opportunity for us to understand, how is the pandemic affecting us all? So we've been able to find the support for over 10,000 veterans, 7,500 of whom are already using these technologies. That's from over 25,000 who told us they use the technologies today in just those 2 weeks. And we're asking, how can these technologies better help us to understand the needs of veterans, especially when they're already comfortable in using these technologies? We've also been distributing 2,500 of the technologies to veterans to better use as part of their day-to-day life concerns, and asking, how can these technologies support their care pathways and understand the value that they can be having. Now, as we heard earlier, sleep and stress affects the whole body, from the head to the toes, from the brain to the bones. These concerns are affecting us all every moment of every day. So what we're doing in the VHA innovation ecosystem is we're evaluating how digital health solutions can better support care quality and the efficacy of care for our veterans and for the people who care for them. I'd like you to just take a moment to think. There's once an aphorism of a boy walking on a beach and seeing starfish, picking them up, throwing them into the ocean, picking one up, throwing it into the ocean. An old man with a graying beard approaches the boy and says, "Young man, there are millions of starfish on the shore. Surely you can't pick them all up, throw them all back into the ocean." And the boy responds, "It makes a difference to this one." And that's the real challenge. Just because there are millions doesn't mean we can't be using these technologies to reach all veterans faster and more effectively The reality being, as communication tools, it allows us to understand the needs of veterans much sooner in ways that maybe they are having difficulty communicating. So what we're doing is evaluating digital health solutions from engagement, from the basic use of these technologies into mapping symptoms, patient-reported outcomes, clinical assessments, and ultimately the clinical endpoints. The care team becomes part of the evaluation process, so we can better assure the quality of these solutions as part of value-based care. And this is how we're innovating on how patients are able to communicate their needs, even when their words are failing them. So the more that veterans are using a digital health solution, the better we can evaluate the impacts with quality assurance into those clinical outcomes over time. In this way, we're building a model of patient-centered care from the veteran based on technologies they're already comfortable using today or would like to be using as part of their care, to send and share their digital health data with VA and evaluate the impacts that those technologies are having. So as I ask you to take a step back and really think about what does resilience mean, ultimately it's how can we better quantify the impacts of stress and sleep concerns for veterans and especially for VA staff, those who care for our veterans, families as well. The reality being that stress and sleep concerns have been affecting us all, and now through the use of these technologies, we can not only measure those impacts, but we can better manage those impacts. For instance, for staff who are suffering from burnout. Well, what is burnout? Now we have the information to be able to understand what does that look like. And for veterans, when is too much stress too much, so that we can better reach out and better communicate our capabilities to support their needs. Now for you in particular, I'd like you to consider how you could be moving more, sleeping better, and stressing less. This is the physiology of the autonomic nervous system, and it's affecting us all every second of every day. That's how our bodies are designed, but we're not designed for pandemics. So by the use of these digital health tools, we can better understand the challenges that we're all facing, not just for you, but for your family, and ultimately for your community. As part of the Office of Healthcare Innovation and Learning, it's been the honor of a lifetime to be developing new ways for veterans to communicate their needs to their families, to their care teams, and ultimately to each other and themselves. As we expand our capabilities to new devices and new capabilities over time, this is how we'll be able to better be able to understand the impacts and how veterans are being affected. So as my time has wrapped as a Presidential Innovation Fellow with the VA, I couldn't be more excited to see the work that's possible ahead, and I encourage you to reach out to Blake Henderson, who's leading our diffusion of excellence capabilities in this area. Amazing individual who's going to be doing such exceptional work for our veterans with the team that supports him on a day-to-day basis. So I'd like to thank you all so much, and thank you for the service that you've given me.